Our work on population health really started sort of 2 or 3 years ago when we've been starting to use HealtheIntent. We're working with Cerner as our sort of strategic partner across Lewisham Health and Care Partners, really helping us to gather and then use our data to improve our decision making and think about how we intervene earlier in people's journeys to really make a difference.
So part of it is about adapting to the needs of our population and encouraging people to feel comfortable in seeking health advice, but also making sure that we can share data effectively so we really do know who's at risk.
Previously, argument was that we don't have any way of integrating it or getting it together. Now, if that is available, I think we have to improve the quality of data, how we code data. In secondary care, a lot of data is there, but it is not coded in a way that it can be captured by any system.
So actually what population management helps us to do is to draw the data together from both the live data systems that hospitals have, community services have, our GP practices, and over time mental health and the local authority too.
People who might have had blood tests done that are actually in the diabetic range elsewhere will be unseen to me unless I have a means of being able to connect up data from a variety of sources to centrally see what their blood results have been. So it increases the opportunity for me to be able to see people who are actually at risk by comparing data sources across a place rather than just from my own practice data.
We are segregating patients into groups based on their level of diabetes control, based on kind of interventions required, based on what interventions have potential to make an improvement, and actually going forward in time and assessing that impact.
Looking at the opportunities that HealtheIntent's given us in terms of identifying people who had diabetes but we didn't know it at the time, we've had the opportunity to be able to inform those people and make sure that they have begun to make the relevant lifestyle changes to prevent future complications, and where necessary to start medication, give them the opportunity to attend structured education programs for diabetes.
So in Lewisham we've been working on Connect Care over the last 3 years, which is retrospective information that's available for clinicians to inform their clinical decision making. But what it doesn't do is then provide the sort of longitudinal record on a proactive basis going forward to help inform clinicians' future decision making. So that's a real plus for HealtheIntent.
I think the future really is about population health. We talk about place-based care, and we've for far too long operated as a group of disjointed organisations, and I'm not just talking about general practice. I'd bring in our secondary care trusts and other providers. It's time we work together and really focused on delivering effective care for everybody.